Well, welcome back. Governor Lamont is joining us live to answer your questions tonight. We know that many of Connecticut's restaurants are struggling because of this pandemic. So the manager of a Middletown restaurant reached out to us on Instagram. Now, he wants to know what your real plan is for restaurants. He's asking, if the case count keeps rising, will you mandate they go to takeout only or reduce in-person dining to 25%? He said his restaurant was gearing up for big business on St. Patrick's Day, and that got canceled suddenly. So he's worried that that will happen again at Thanksgiving. Governor Lamont, would you address some of his concerns?
Yeah, Irene, you're right. If the infection rate continues to go up, we've got to do everything we can to bend the curve. I don't want to unnecessarily hassle people, but we want to do things that make a difference. I got to admit that I look at our other states around the country, and restricting indoor dining is one of the things that is on the menu, so to speak. In this state, what we've already done is we've limited capacity to 50%. Strongly recommend you eat outdoors if you can in a tent with a heater. And we've made sure that they close by 10 o'clock. And I'm doing all these things just to try and keep these restaurants open safely. But the metrics may determine a change.
All right, so here's a question from Christina in Middlebury. Because of the coronavirus, restaurants, as we know, they're all struggling. She says, delivery is our lifeline right now. Would you consider putting a cap on DoorDash, Uber Eats, and Grubhub fees for restaurants? The fees right now are about 35%. Other states have capped them at 15%.
I think that makes pretty good sense. You want it at a rate that people are able to deliver the food, especially to seniors, especially to those in quarantine. But I don't want people ripping us off either. That's a good point.
Is that something that you might consider?
Yeah, and maybe have to do that with the legislature. I'll see if I can do that by executive order. Let me get back to you on that. Good thought, though.
Okay, thank you for that. All right, let's talk masks for a moment. Stephen in Cheshire writes, Mr. Governor, if you made it mandatory to wear a mask in public, why are some people walking around in stores without a mask? Stores
illegal.
Cannot issue tickets. Yes, we're seeing that today in New Haven. Now, wouldn't it be prudent to increase police presence, he says, in stores by writing tickets? Is there a mask mandate you can do that would be more strict than what you've done about masks so far?
Well, we've been pretty strict, I got to tell you. You are obligated by order to wear a mask if you're indoors. If you're in a store, you're in a nail salon, something like that, you must wear the mask. And if you're outside, wear the mask unless you're, in a remote place where you've got plenty of distance between you and others. And I got to tell you, we have enforced that. You are subject to a fine. In 99% of cases, people are doing it themselves, but we often get a call. We say somebody refuses to wear a mask in the store, and the public health or local police will go there and kindly escort them out and make them subject to a penalty.
So there are fines being levied against these people who are not wearing masks by the state?
There are, especially if you're doing that on purpose.
Okay. All right. We're coming into the holiday shopping season. Now, Jessica from East Hartford shared her concerns. She writes, we've heard a lot about schools and restaurants, but nothing about retail stores and capacity levels. There are a lot of people packed into stores, especially now that it's the holiday season.
Yeah, Jessica, we have found that if stores follow the rules appropriately, no more than 50% capacity, keep the 6 feet of distance at the cashier's line, wearing the mask, we can operate stores safely. But as you point out, I got Black Friday coming up, a big shopping season. If people get casual about the rules in the stores, that could change as well. So far, I think we're able to manage this pretty appropriately.
All right. All right, we're back and we're talking about vaccines now with the governor. Some positive news today. Pfizer will be applying for emergency use authorization for its vaccine on Friday. Now, Governor, what does that mean in terms of when that first dose could arrive here in Connecticut?
It means we're going to get through this, Irene. That's the first thing. I don't want to depress the heck out of everybody. As you heard Dr. Scott Gottlieb say, we're probably in the 7th inning of this long baseball game. The final 2 innings are decisive but there is an end to this, and the vaccine's a big part of that. Pfizer and Moderna will be rolling out their vaccines subject to the final FDA approvals, I think by mid-late December. Deirdre Gifford, our amazing head of public health, is putting in place the structure we need to be able to get those vaccines out to people as needed, starting with the most vulnerable in nursing homes, our first line responders. And we're not going to do it until we know it's safe and effective.
So Susan in Bristol, along that same line, she'd like to know, what age groups would you suggest get the vaccine first? I think you talked about that a little bit. Your vaccine advisory group is meeting to figure out distribution. So will age have a role in when a person gets the vaccine, or are there other factors there too?
Age has a role. We'll be focusing on the nursing homes. They were hit so hard early on. We'll be focused on folks that have a pre-existing condition, comorbidities, they call it, to make sure they're the most vulnerable. We'll be focused on the first responders, people who have to go to work. Those are nurses, those are doctors, those are teachers, those are daycare operators, those that can't telecommute. Those will be some of the priorities.
And a quick question from Tim in Waterford. He says, when someone gets the vaccine, will they still have to wear a mask? Will they get a letter or certificate stating that they have the vaccine and are exempt from the mask?
Tim, I hadn't really focused on that, but I'll tell you one thing. I'll still wear the mask a little while longer. I think it makes sense. By the way, these two vaccines, you have to take 2 doses before you know they work, 3 weeks apart. It's going to be a monumental effort. We got 3.5 million people, 2 doses, 7 million doses overall, prioritizing those folks. In between, I'd wear the mask.
Okay, so we've seen the long lines for waits for the testing. Is this a foreshadowing of what might happen, you think, when the vaccines are ready?
I don't think so. I'll tell you why. We've got CVS, we've got Walgreens, we got Stop and Shop, we have our hospitals. We're going to have a wide variety of places where you can get the vaccine. And let's face it, we're prioritizing different populations. Some may be a little hesitant to get the vaccine early on, so it may be somewhat self-regulating. But I really hope, Connecticut's been a leader in people getting the flu vaccine. I think we know that if the vast majority of our people get the COVID vaccine, we're going to be playing baseball this summer.
I hope so. How will you be spending your Thanksgiving this year? That's the big question.
Well, we usually have a big Thanksgiving dinner. All the kids bring a friend who's probably from another country and doesn't have a place. We get to explain Thanksgiving. This year, it's going to be the 6 of us. So I feel their pain, stuck with the old man this time around, but it's the safe way to do it.
All right. Thank you so much for being with us. Governor Ned Lamont, we really appreciate you taking the time to be with us. And remember, now is the time to double down, everyone, and mask up. We can do this. Connect.